afternoon, good evening, everybody. My name is Ruth Richardson, and I am the Executive Director of the Global Alliance for the Future of Food, which is a philanthropic alliance of foundations around the world committed to food system transformation. Welcome to Food Systems Fit for Purpose, the world's leadership to prioritize human, animal, and ecological health. We are thrilled to be part of the Committee on World Food Security's high-level virtual special event on food security and nutrition this week.
Donc, il s'agit.
The Global Alliance for the Future of Food is pleased to co-host this partner event with Food Foundation, Gardens for Health International, Healthcare Without Harm, Switzerland, UN Environment Program, World Obesity Federation, and the World Health Organization. Before we get started, I would invite any of the audience to introduce yourselves in the chat box. Maybe just put in your name and organization so you can say hi to one another. And I also invite you to make comments in the chat box, as well as to ask questions in the Q&A box, which we'll get to later in the agenda. So let's get started. From COVID-19 and famine to the climate crisis, Build Back Better isn't enough of a rallying cry to respond to the scale of the emergencies that we face today. Transformational change is needed. With food systems holding the key to many of the solutions we need, we must urgently shift the prevailing narratives and mindsets that are holding back change. Breaking away from simple narratives about yield and food production at all costs, it's time to recognize how fundamental animal and ecological health are to human health, well-being, and happiness. This must be supported by bold leadership and an integrated approach to policy reform. Coordinated action must be taken across government departments, supported by meaningful and inclusive multi-stakeholder dialogue and collaboration. During this webinar today, we will highlight why it's time for a new narrative and new action around systemic solutions in the context of food security, nutrition, and planetary health and recovery from the COVID pandemic. We have convened an amazing panel of leaders to share their stories of how a positive vision and holistic integrated approaches to policy and practice can deliver healthy, resilient, and sustainable food systems. These stories were selected from a set of case studies that the Global Alliance for the Future of Food has just published called Systemic Solutions for Healthy Food Systems, a government guide to action and approaches to policy and practice, as well as a forthcoming publication by the One Planet Network Sustainable Food Systems Program. This will be followed by a discussant panel to provide global insights based on the learning from the panel, as well as their own work into what is needed to move forward together. I'll introduce each of the panelists and the discussions in turn. So let's get started with our panel. As I mentioned, we want to talk about some stories of transformation that are inspiring and help guide us into the future. Again, the first of the three case studies are from the Global Alliance report, and the fourth case study is from the forthcoming Sustainable Food Systems Program, One Planet Network report done in partnership with the International Center for Tropical Agriculture. Our first panelist is Solomon Makuza, who is the Executive Director of Gardens for Health International in Rwanda. Solomon is a public health specialist. He's here to tell us about his organization, which is a not-for-profit that works at the intersection of health and agriculture to provide community-based participatory solutions to malnutrition. His organization partners with health clinics in rural and peri-urban areas so that families facing malnutrition have the knowledge, resources, and support to meet their nutritional needs and to thrive. So Solomon, my question for you is, can you briefly explain about the Gardens for Health initiative and why it is even more critical in the context of COVID-19? Over to you.
Thank you so much, Ruth. Good morning, good afternoon, everyone. I would like to start off by thanking everyone who made this possible. We are really honored to be part of this important conversation. As Ruth rightly introduced me, I work with Gardens for Health, and we are based in Rwanda, working at the intersection of health, nutrition, and agriculture to fight against malnutrition. As you may know, the majority of the world's people are farmers, and yet the interesting thing is that they remain in poverty, and millions of children are malnourished. This disconnect between food and nutrition is alarming, and it shouldn't be this way. Um, Prior to the onset of this pandemic, statistics already show that more than 690 million people are identified as chronically food insecure, and about 250 million of those are on the continent in Africa. And we have about 144 million children who are chronically stunted. So this is alarming. And what this means is that what we have seen is that a lot of smallholder farmers are farming, and yet children and expectant mothers are not necessarily eating the diet that provides for their body's nutritional needs. The simple concept that access to food alone doesn't equal good nutrition is at the core of our work. For more than a decade, we have been working to tackle the twin challenges facing vulnerable families around the world and in Rwanda, and those are a lack of access to diverse, healthy food and a lack of education around good nutrition. We do this by providing nutrition, health, agricultural education, coupled with quality agricultural inputs, such as seeds and livestock, so that families are able to grow and consume nutritious food from their own background. We've worked with more than 15,000 families as of to date, and we keep on ongoing.
Fantastic. Thank you, Solomon. And great to start off the discussion with a focus on smallholder farmers, because as I think is increasingly recognized, they are at the sharp end of climate change, COVID-19, of the nutrition crisis. And so really appreciate your perspective and the work that you do with smallholders. Our second panelist is Nilani Sritharan, she's the Group Health Living Manager at Sainsbury in the United Kingdom, which is the second largest supermarket chain in the UK. Nilani spent several years working in nutrition communication and health policy roles for various not-for-profits and companies. She is also currently Secretariat of the Nutrition Working Group for the UK Food and Drink Sector Council and represents Sainsbury's on various committees and boards, including the External Advisory Board for the World Food Programme. She is here representing Peas Please, an initiative hosted by the Food Foundation in the UK that brings together farmers, retailers, fast food and restaurant chains, caterers, processors, and government departments with a common goal of making it easier for everyone to eat vegetables, a very laudable goal. So Nilani, can you explain briefly about the Peas Please initiative in the UK and why it is even more critical in the face of COVID-19?
Yes, thank you so much, Ruth. So thank you also for the invitation to come and talk here and share a bit more about the Peas Please initiative. As you've explained, Peas Please is an initiative from the Food Foundation, which seeks to bring about changes through systems, cities, businesses, and government. Now, businesses are given basically a framework to operate within, with a common objective about increasing vegetable sales. But we as businesses are then free to set our own commitments. So we are held account to this, and we have to report annually against that commitment. In addition to that, that commitment is made publicly available so that anyone can see them. And given that 1 in 4 school children, high school children, consume less than 1 portion of vegetables a week in the UK, I mean, it's a shocking statistic. And during lockdown, we've seen that prove to be especially challenging for many families. As Sainsbury's, as you said, we are the second largest retailer in the UK, and we have a real ambition to help our customers live well for less. So we already do the basics. So we have front of pack labelling, we ceased doing multi-buys back in 2016. We don't direct our advertising to children under 16, and we've been reformulated for many years. But we really wanted to look at what does leadership look like. And so for Peas Please, we actually set ourselves one single metric to report on annually. And that was what proportion of our total sales came from vegetables. Seems really simple, sounds really straightforward, but in actual fact, we've got to go through every single product to work out the vegetable content of it. What we know today is that 12% of our sales come from vegetables. as a baseline, it's a starting point. And it's not really just about that one figure that has come from the Peas Please initiative. It's that one figure has unlocked so much else for us. So we now know where to act. We know what products need to be reformulated. We know how to inform our customers about their vegetable intakes. We're able to link that information to purchase and incentive. And we've actually seen that that's been particularly successful. So we've seen a 250% uplift in vegetable and fruit sales, I should say, when we link it to incentives. And those are just some of the examples that come from that Peas Please initiative. So in summary, we've partnered with the Food Foundation, which is a public-private partnership that more transparently reports on the progress of companies to help increase vegetable sales in the UK.
Great, thanks, Delani. And you said that 12% right now.
Yeah.
What is your goal? Do you have an aspirational goal?
We're working on that at the moment. So what it's done is unlock kind of where we need to work. I think from the Food Foundation, what they've explained is the ideal would be 18%, which is quite a lot more, especially when you look at the balance of total sales. So quite a journey to go on, but we're certainly working towards that.
Fantastic. Well, thank you so much. And it's a really interesting idea about how this sort of small action has unlocked a whole host of opportunities and possibilities.
Yeah, absolutely.
So it's very important to hold that, especially in light of the situation we're in now and how we move forward. So thank you very much for that. Our third panelist is Dr. Lorena Rodriguez, who's a professor at Escuela de Salud Pública. I hope I said that okay. I'm not a Spanish speaker, so I'm sorry if I mispronounced that. That is with the Universidad de Chile. Lorena is a pediatrician who has worked in the space of public nutrition for the past 20 years. She was formerly the head of the nutrition department of the Ministry of Health in Chile, and she is here to tell us about the country's effort to fight rising obesity levels, especially amongst children, through a package of policies targeting the marketing of unhealthy foods. So, Lorena, my question for you is, you were a leader in crafting the development and the implementation of the Consumer Information Law in Chile, which has been seen as a model for other countries around the world. Can you tell us briefly about the issues the government was trying to address with this package of policies and why this approach is even more relevant in the context of COVID-19?
Buenos días, buenas tardes y buenas noches a todos los presentes. Muchas gracias por esta invitación. Desde la Universidad de Chile es un orgullo poder compartir la experiencia de Chile en el cambio de entornos alimentarios. Como bien decías, Ruth, en Chile las cifras de obesidad que incluyen a los niños más pequeños son muy altas. Y la principal razón a la cual se atribuye es el entorno alimentario poco saludable que nos rodea y que promueve una mala alimentación, además de altas cifras de sedentarismo. Chile, a través de la ley que llamamos Ley de Etiquetado de Alimentos, lo que aspira es a mejorar el entorno alimentario mediante 3 medidas. Un etiquetado claro, frontal de alimentos mediante un disco pare negro con el concepto alto en calorías, azúcares, grasas saturadas y sodio, pero también la prohibición de la publicidad dirigida a niños de cualquier alimento que tenga este disco pare y la prohibición de venta de estos alimentos en los establecimientos educacionales. De esa manera, integralmente se están abordando 3 ámbitos del entorno alimentario: la información clara y sencilla, el entorno escolar donde los niños pasan mucho tiempo, muchas horas del día, y también la exposición a la publicidad abusiva de los alimentos poco saludables. En el contexto del COVID, donde la inseguridad alimentaria se ha hecho una realidad en muchos países y ha empeorado en muchos otros países, nos parece que la oportunidad de transformar los sistemas alimentarios y de mejorar los entornos alimentarios cobra mucha relevancia. Esta pandemia nos encontró en una situación de alta vulnerabilidad, no solo en términos de acceso a alimentos, sino que de acceso a alimentos de buena calidad nutricional. Para Chile ha sido una experiencia que estamos evaluando, exitosa en su implementación, pero tenemos que esperar ahora los resultados en términos del cambio de conducta alimentaria y también en el cambio de situación nutricional. Esperamos ir avanzando por buen camino y efectivamente estamos colaborando con otros países que quieren avanzar en la misma línea para mejorar los entornos que rodean a las personas y especialmente a los niños y niñas.
Great, thank you very much, Lorena. And it occurs to me that as you're talking, that there'd be a really interesting discussion about the public determinants of health, which are as relevant to malnutrition as they are to COVID-19. And very much appreciate your shout out to work with other countries, because we know that transformational change is going to require cooperation across nation states. So very much appreciate your appeal there. Our final panelist is Dr. Dao Thanh, Vice President of the Vietnamese Academy of Agricultural Sciences in Vietnam. He has held many research roles, including in agriculture, rural development, food economics, and is a proponent of a systems approach. His research topics focus on agroecology, governance, climate change, biodiversity, livelihoods, and poverty alleviation strategies. He is here to tell us about an initiative in North Vietnam supported by CIAT, the International Center for Tropical Agriculture. So, Dr. Dao, my question for you is, you have been central in the participatory science-based approach to create a common understanding of food systems in North Vietnam in order to co-design policy solutions. Can you briefly explain your local national situation, the initiative you are representing, and how the multi-stakeholder approach is so critical as we consider ways to move forward on COVID-19?
Thank you, Ruth, and good morning, everybody. So, you know that Vietnamese food system are undergoing in the very rapid transformation. In terms of production, now Vietnam is number 15 of exporter of agricultural product with different type of product. But the form of agriculture is changing rapidly from the family farming base for local food securities. Now we become more and more commercialized and specialized system for crop and livestock production. And for this, we have very fast achieved for poverty reduction. But the challenge is that even in this context, the diet become poor and poor and less diversified. So we are facing the triple burden of the malnutrition is that more than 25% of stunning among children under 5 years old. And for example, 26% of the children anemic and 21% of adults overweight. So this is a really high indicator in for the malnutrition. So we think that we need some coordination between the agricultural sector and health sector and for nutrition. But not easy to work together because firstly, we don't have with the food system. The initiative is to apply the food system to design the policy. The problem is that we lack of data from different sectors. And for this, we need some evidence. So so we decide with the support from CIAT and different research institute in Vietnam. We work as a consultancy for the government to bring Zero Hunger Initiative National Action Plan in Vietnam. So this is at the macro level is multi-ministerial participation in a platform, Zero Hunger. So including Ministry of Agriculture, Ministry of Health, Ministry of Education, etc. So the objective is to contribution for the development of agriculture, but sensitive with nutrition and health question improvement in Vietnam. We are willing to promote the agricultural sensitive approach, nutrition sensitive agriculture development approach, because up to now the agriculture is too much oriented in the commercialization and exportation, and we are trying to develop some local initiatives, because at local level also the local authorities may be focusing too much on the commercialization, and with the SIAT and the Institute of Nutrition and Institute of Agricultural Sciences, we work with the local authorities to conduct some survey, some diagnostic, and to build a quantitative food system profile for each location, maybe for the district. So based in this, we organize some participation workshop with different stakeholders at local level, and farmers say that I'm reaching, but still malnutrition is the key problem, and maybe our children not eat enough, not have a good diet, etc. So, and how we have to change the situation of at local level. So at the same time, we focus on the policy lobbying at the national level and at the local level. And during the COVID, we can observe that different value chain have different type impact. The exportation value chain is ruptured because the transportation to international is stopped. But the short value chain and for local level is still running very well. And this is a good opportunity under COVID for promoting the local value chain to feed the local people with the diversified diet. So we are promoting with the participation of different research institute and university to develop this approach at local level and organize a lot of training and based on the food system profile approach. Thank you.
Great, thank you so much. And we certainly are hearing a lot more about the need to really localize our food systems. So very much appreciate you bringing that forward. And I would also just direct your attention to the Q&A box, where there's a lovely comment from Chris Hagedorn from the Committee on World Food Security about the importance of these issues, and being very excited to hear from you and your experience in Vietnam. So please have a look at that note directed towards you. So we've got a few minutes for questions. I see some people have been putting questions in the Q&A box, and I certainly have a few others, but maybe I'll look first to the Q&A box, and I have one question that I'd like to direct to two of you each. And so I'll point towards that as I get into the question. The first one is really about the power of procurement, public procurement in food purchasing. And the question is that major flagship reports stress the need to reduce meat and dairy consumption and increase plant-based eating. This is also vital for future pandemic prevention, given the major role of public procurement in food purchasing. Why are more countries not prioritizing a move to plant-based foods in their public procurement? So I'd like to direct this to both Nilani and Lorena. So Lorena, maybe I can start with you, and just some thoughts on why are governments not putting more priority on plant-based diets, particularly related to procurement? Lorena?
Bueno,
Ujú.
pienso que las políticas públicas efectivamente tienen que ser concordantes con las compras públicas. Si un gobierno está promoviendo las guías alimentarias poblacionales, donde los principales alimentos que se recomiendan son las frutas, las verduras, las legumbres, evidentemente eso debe ser concordante con las compras públicas que se hacen para los programas de alimentación escolar o para programas de soporte de poblaciones vulnerables. En el caso de Chile, nuestras compras públicas están obligadas a respetar la ley que impide que se compren alimentos ultraprocesados con altos contenidos de energía, de sal, sodio, grasas saturadas y azúcares. Debe ser concordante la compra pública para los programas alimentarios estatales con nuestra ley de etiquetado, con nuestra ley de alimentos. Respecto a preguntas específicas como proteínas en base a carnes, animales o en base a lácteos, en Chile aún tenemos déficit de algunos micronutrientes como calcio y otros, hierro, zinc y cobre, cuya fuente principal son este tipo de productos de origen animal. Aunque hemos ido recomendando su progresiva disminución, eso no está suficientemente basado en evidencia como para sugerir su suspensión. Sí que hemos ido disminuyendo las proteínas de origen de carnes rojas hacia carnes blancas y mantenemos todavía la recomendación de lácteos, especialmente en etapas claves de desarrollo y crecimiento, como sería en la infancia y eventualmente en algunos momentos de la adolescencia. Sin embargo, concuerdo con que las dietas tienen que ir hacia alimentos frescos y naturales, principalmente aquellos de origen vegetal con algún componente para cubrir estas necesidades de micronutrientes que estoy nombrando como hierro, cobre, calcio, zinc, que todavía nuestras poblaciones son limitantes.
Great, thank you so much for that perspective. And Ilani, from your perspective in the UK, what are the stumbling blocks here?
I think actually UK have a national food strategy that is currently underway, and I know that looking at healthy and sustainable diets for all is going to be the kind of second focus of that report. To the question around procurement, I think that will come, but I think what's first needed is, yes, we know that we need to look at how we produce and how much we consume of meat and dairy. But to Lorena's point, actually, I think we need to look at the totality of the diet. So, those food groups do provide certain key nutrients. And we need to have much better data to understand where to act, to know how we can improve the production of those particular ingredients, but also to think about the totality of the diet. So to her point, how do we actually increase plants in our diet? Because actually, I think at least in the UK, we've seen a real trend towards plant-based foods, but they're not necessarily healthier alternatives. It tends to be the sausages, the burgers, the mince that does well. And actually, when we've ranged those in the meat aisle, we've found that customers haven't necessarily reduced their meat consumption. So I think there's a lot more that needs to be learned about how we can transition customers towards a healthier and sustainable diet, but also where we can act to help improve the productivity and the environmental impact, and we understand the true cost of food right across the food system.
Interesting, fantastic points. And great to get your perspective in terms of what you're seeing in terms of dietary patterns changing or not. So very important. We have a couple of questions that relate to shifts from traditional food systems to more centrally planned commodity approaches. This connects as well to some questions around kind of regenerative agriculture approaches. and more ecological approaches. So I'd like to ask this question of both Solomon and Dr. Dao. Essentially, what do we need to do to really be supporting, some of these traditional food systems and approaches that are more based on regenerative and ecological practices? So maybe Dr. Dao, first I'll ask you that question and then I'll turn to Solomon. Please, Dr. Dao, go ahead.
Yes, thank you. I think that in Vietnam, we are in the period of post-Green Revolution. And during this Green Revolution, farmers use a lot of chemical fertilizer, pesticide, etc. Now we are willing to promote agroecology approach at local level. So the education, training for local people is very important. And also we have to organize, we develop some project to support the transition from chemical agriculture to agroecological agriculture. So we also organize education and then communication for consumer, because consumer should know about the farm practice change, and they adopt for the buy the product. So this local value chain approach or agroecological approach is and supporting for the transition of the food system. And another question for Vietnam is to guarantee the food safety. The question of food safety is also important, and we organize a lot of training for producer, and also attract consumer to participate in the short value chain in order to control the food safety practices. Thank you.
Great. Thank you, Solomon. What about for you? You've been working in the trenches in Rwanda, and what do you think it's going to take to really unlock the potential of going back to and embracing kind of more ecological and regenerative practices?
Absolutely. I do think that there's value and substance in looking at this question from the angle of the supply side and the demand side. One of a few things that we have seen as limitations, to the farmers, that lead to the lack of farm diversification, low productivity, and high post-harvest losses. All these come together, they limit the availability and access to nutritious food. We see the lack of quality seeds being one of the challenges for farmers rather to be able to produce a good crop. And then we have, climate change that is complicating matters, food safety, as Doctor just mentioned. So really being able to, work with farmers to provide, opportunities to provide different, alternatives that helps them to target the challenges that they are facing. And I think from the Rwanda perspective, what we are seeing, the Ministry of Agriculture has been intentional, and someone actually asked this question, in being more open and showing interest in the fact that, we need to acknowledge that, food systems, for them to be resilient, we need to acknowledge the importance of nutrition and healthy diets in that. So that is one way. On the demand side, I do think that people who need vegetables, what we see most may not be aware of the benefits to nutrition and health. And also there is an element of they not being able to afford them. So how do you make sure that you're providing knowledge and education around the benefits of these vegetables, and also providing access for them to be able to afford them? And on this point, I also have to mention that we have actually, an opportunity that they are traditional indigenous, vegetables that have proven to be resilient, that adapt in different growing conditions, that have been part of cuisines. If you look into some of the things that my grandmothers and what I grew up eating, you do find a lot of, incredibly nutritious varieties of indigenous vegetables that needs, again, a place on the table. So there's need of promote education awareness, there's need of targeting the challenges at the supply level from production up to the market, and also there's a need of providing alternatives, for farmers.
Fantastic, thank you. So I see other questions in the chat box, which we won't be able to get to right away, but I would encourage any of the panelists, if you want to go in and answer live, that would be great. Particularly some questions around dairy and the consumption of milk. So it would be interesting to get some thoughts on those questions. Before we turn over to our discussants, I just want to do a really quick round with the panelists and ask you very briefly for a response on what is your one call to action for the Committee on Food Security community based on what you are learning and observing. So just a very quick call to action. What's the one thing that you would hold up for the CFS community? I will start with Lorena.
Bueno, gracias por la pregunta. El contexto actual, donde coexisten varias pandemias, la pandemia por COVID-19, la pandemia de obesidad, en algunos lugares aún pandemia de hambre y de desnutrición, aumento progresivo de enfermedades no transmisibles y cambio climático, mi llamado es avanzar juntos hacia sociedades más equitativas y sistemas alimentarios más resilientes y saludables. Van a venir nuevas pandemias y tenemos que estar mejor preparados. Pero estos sistemas también tienen que ser sostenibles. Algo de eso ya hemos estado hablando. Con políticas públicas que tengan en consideración factores estructurales comunes a estas distintas pandemias que hemos llamado una sindemia global. Y estos factores estructurales apuntan al nivel educacional, al nivel socioeconómico, a la calidad de vida, a la disponibilidad y acceso a alimentos saludables, y se requieren, por lo tanto, políticas públicas potentes, como las medidas fiscales, que mejoren los precios de los alimentos saludables, el acceso, que tengan subsidios a la producción de pequeños agricultores y de pequeños pescadores, y que fomenten los circuitos cortos como circuitos positivos, de feedback positivo, en que la producción y el consumo local favorecen además las prácticas culturales ancestrales, la recuperación de tierras, el acceso al agua y el derecho a la alimentación. Creo que el desafío es grande, es importante que reuniones como estas nos permitan relacionarnos y formar redes para poder construir un planeta más saludable con individuos y con comunidades más saludables. Mi llamado es a la acción conjunta.
Fantastic, thank you. So very briefly, Solomon, your call to action.
Sure. Yeah, so we identify ourselves really as a community-based organizations. There's such an impressive wealth of knowledge and experience and understanding of what could work, within the community. So based on that, my call to action is really, to elevate and invest in local community-based solutions that connect and promote nutrition and healthy choices into food systems.
Great, thank you. Nilani, your call to action, briefly.
Sure. I think, food, nutrition, and the sustainability of that food supply could not be more front and center for the reasons that have already been discussed. What we need, in my view, is real clarity and consistency of standards globally. We're a British retailer, but we buy food from all over the world, so that does need to be better kind of coordinated. We need better data that is being kind of pulled together right across the system. And examples like the Global Food Systems Dashboard and Feed UK, which is an infrastructure project across the sector, are good examples of that. And then finally, we need really clear outcome measures. So we need to understand, what is it that everyone's looking to achieve? I think the Food Foundation's Plating Up Progress report, which actually outlines a set of measures for sustainability, for business, and really gives that clarity of what is expected of us, is a good example of that. So common outcome measures, global standards, and data shared across the system.
Great, thank you. And Dr. Dao, very briefly, what is your call to action?
Yes, my call for action for CFS communities, we have to promote agroecology in the approach in the agriculture and production in order to keep the agriculture diversified, not go to monoculture and commercialize agriculture. And this is very important, and many policy makers don't believe on this. So because they think that maybe agroecology cannot respond to the food security, but we think that we need some evidence from different countries to show that agroecology approach can support the food security and nutrition securities.
Great, thank you, all of you. Fantastic panel. We're now going to turn our attention to two discussants to provide global insights based on the learning from the panel, as well as their own work and what is needed to move forward together. Both of these discussants have important vantage points at the national and international levels to complement our panelists who've shared their experience and expertise at a more kind of local level. So our two discussants are Dr. Francesco Branca, who's the director of the Department of Nutrition and Food Safety with the World Health Organization, where he has led the development of the WHO's nutrition strategy, established a new nutrition guideline development process, and developed a comprehensive implementation plan on maternal, infant, and young child nutrition. He has been leading the preparation of the Second International Conference on Nutrition and Secretariat of the Decade on Action on Nutrition. Our other discussant is Alvin Kops, Deputy Assistant Director General with the Federal Office of Agriculture in Switzerland. He is Associate Head of the Knowledge Systems Technology and International Affairs Directorate, and he leads the Unit for International Affairs and Food Security. Prior to joining the Swiss government, he was founding director of a consultancy firm in strategy development, sustainable development, and change management. And he has held leadership positions in academia, civil society, as well as industry. So, question for each of you. First of all, Francesco, what are you observing in the context of COVID-19 and other global health challenges with respect to food systems, and how is the WHO responding?
Thank you very much, Ruth, and good morning, good evening to everybody. Let me show you something to answer this question. So, there are multiple ways through which food system impacts on health, and I really would like to refer to the beautiful report that was produced a couple of years ago by IPES Food. First of all, the occupational hazards. Second, the environmental contamination. Third, the contaminated, unsafe, and altered food. Fourth, the unhealthy dietary pattern. And fifth, the food insecurity. And I particularly would like to highlight the impact channel number 4. You can see that, if we combine the different forms of malnutrition, the high body mass index, the dietary risk, the child and maternal undernutrition, they basically together account for 20% of the global total disability adjusted life years. So, really multiple times other risk factors. Now, COVID-19 has actually highlighted the weakness of the food system, and it has made some of these impacts even higher. Now, first of all, the origin of the virus is probably located in the food system. It's a zoonosis, similar to other previous pandemic we have, and we've not been able to prevent it through, for example, adequate food safety in traditional markets. but it has also had an impact on occupational hazards. Workers in the food system got sick, and the disruption of the food system is also linked by the fact that food workers couldn't go to the fields to collect fruit and vegetables, or transporters couldn't do that, or employees in meat packing factories were getting sick. And then, of course, a major impact on food insecurity and on unhealthy diets. Now, what is WHO doing there? First of all, the call to action on wasting that was launched jointly with other UN agencies to really respond immediately to the food insecurity crisis and to make sure that the services to address malnutrition could be reestablished and scaled up. Second, the work on the UN Food System Summit, really calling for a major shift, systemic shift in the way we design our food system. And third, the development of a new food safety strategy at the request of the World Health Assembly.
Fantastic. Thank you, Francesco. Really appreciate that. And you're holding up some of the very good research that's been done in the past while that we can certainly draw upon as we think about solutions moving forward. I would like to now turn to Alvin. The question for you is that Switzerland is co-lead on the One Planet Network Sustainable Food Systems Program. Can you tell us briefly about this initiative and what you have learned from convening a multi-stakeholder dialogue, which is certainly held up as one of the priorities, as a global community? How have you applied this learning at the national level?
Thank you very much, Ruth, for this question. It's indeed I think you gave me 4 minutes, so it's going to be tough to answer all that. But the One Planet Network Sustainable Food Systems Program, I call it the SFS program, it's a bit shorter, is an action-oriented global dialogue that has been ongoing for 5 years now. But its history actually goes in further back when FAO and UNEP, with the support of Switzerland, set up an interagency task force on food systems in 2011 as a direct follow-up of Rio+20. Currently, under the leadership of Costa Rica, Switzerland, and WWF, the program aims to accelerate the transition to more sustainable food systems by promoting a holistic food systems approach through dialogue and action. The program is a multi-stakeholder network with currently 180 partners globally and has a core group of 20 champion organizations representing all stakeholder groups. It includes FAO, UNEP, IFAD, the World Economic Forum, Nestle, HIVOS, South Africa, the United States, just to name a few. So the program elaborates tools and organizes workshops to support stakeholders promote food systems transformation. It advocates for sustainable food systems in international policy processes as well. One major lesson from convening this multi-stakeholder dialogue over the past 5 years is that you need to speak a common language in order to have a meaningful dialogue and follow-up action. What I mean by this is that people, administrations, organizations have all different kinds of ideas of what a sustainable food system could or should look like. To some, it means no meat. To others, it means no GMOs or no synthetic fertilizers. Others may stress primarily a healthy nutrition and poverty reduction without giving the same weight to environmental considerations. So in a multi-stakeholder setting, you can easily end up in what we call a dialogue dessous in French. So you actually talk to each other, but you don't understand each other. Therefore, the FSS program, we decided that we need to build and promote a common understanding of what we understand by sustainable food systems and how they can achieve how they can be achieved through a holistic approach. The process of developing a common language has not always been a smooth journey. However, after many rounds of consultations, I'm proud to announce the publication towards a common understanding of sustainable food systems, or what we refer to as the SFS glossary. This document discusses the sustainable food systems approaches and presents the main strategies for transformation to more sustainable food systems. In addition, it contains a comprehensive glossary of terms that are of relevance to sustainable food systems. This glossary will be published later this year at the occasion of the third Global Conference of our program. It is accompanied by the program's collaborative framework for food systems transformation that provides a pathway towards more inclusive and holistic policy making, as well as a set of case studies being curated by the FSS program, one of which was presented earlier by Dr. Dow. So now coming to what this all means on the multinational level in Switzerland. I think promoting the common understanding on food systems at the global level has helped us make progress on the policy level in Switzerland as well. In particular, we are anchoring food systems as a cross-cutting topic in the new upcoming Swiss strategy on sustainable development, which is our main tool for the implementation of the 2030 agenda at the national level. We are now working on the development of concrete food systems targets for that strategy, which will combine healthy nutrition with sustainable production methods, food loss and waste, and reducing GHG emissions across the entire food supply chains. In addition, we have just recently initiated a series of food systems dialogues, which will both serve as input to our national food and agriculture related policy processes, but also we hope to feed that into as a contribution towards the Food Systems Summit of the UN next year. Thanks.
Great, thank you so much. Very, very important perspective, and we look forward to getting our hands on that report for sure. So I have, I'm going to slip in an extra question for the two of you. I do want to ask you about your call to action so you can kind of tee up your thinking on that. But first, one of the things that we wanted to get out of this session was to get into this issue of sort of narratives and mindsets. And you know, there's been greater talk of the importance of sort of global narratives around the food system, which are essentially stories that we tell ourselves about what is possible and what is not possible. And we see this in you know, many of these sorts of meetings, in reports, in the political dialogue. I would love for each of you just to comment a little bit on what are the narratives that need to shift in order for us to be able to embrace some of the solutions and directions that have been presented today. So Francesco, maybe I can point to you first.
Sure. Well, first of all, I believe that an important shift we've seen since 2015, basically, is understanding that we're dealing with multiple forms of malnutrition. The second important shift is that we're understanding that there is an alignment between the actions we can take to improve the safety and health value of diets and what we can do to have a positive impact on the planet. So the agenda of health and sustainability have actually been coming together. And perhaps the third shift is the consideration of the systemic nature of the change which is required. It's not something that can be achieved by a single player, but it has to be achieved by a multiple set of societal actors. However, this needs to be done in a coherent fashion. So we cannot have simply independent commitments of actors that do not consider what is needed and what others are doing. There must be an overall alignment of policies towards certain goals of providing healthy, sustainable diet to the majority of population. We know that that is a challenge because there is a big issue about the equity of access to the diet. As I've seen from the State of Food Security, 3 billion people do not have access, cannot afford healthy diet. So these solutions need to be developed for all.
Great, very interesting, Francesco. Thank you for that. And Alva, how about from your perspective in terms of kind of these narrative shifts that need to happen for us to be able to embrace the solutions that are going to help us move forward.
I think one of the important shifts that need to happen is that we need to start talking about sustainable diets, meaning that you have to bring together sustainable production and a transparent supply chain, and finally the outcome is a healthy diet. So you need to bring those things together. We used to discuss a lot about, nutrition, then okay, what's then the diet from there, and in another silo we talk about production methods. And I think we really need to bring those two elements together in order to make that next step. Francesca also said that we need to understand this is a complex system, and the food systems itself is, relates to other systems as well. So I think we need to still better understand that, but we shouldn't use the complexity of food systems as an excuse to do nothing. That's what I hear a lot these days. Oh, it's so complex, and what should we do? And I think we know it is complex, but I think that shouldn't impede us from moving forward. Another shift that needs to happen is I would say true costing. So we need to understand the true cost of food, and this then needs to be translated into changing business models. You see that already now today. You talk. There are publications out there also from companies that look at doing nothing as a risk. So they understand we need to transform in order to manage that business risk. And I think that is a big shift that is taking place, slowly taking place, maybe too slowly. But I think we need to build on that. So we need to change a little bit the story about, if you want to have action on the ground, you also need to need to talk that language, that business language, and what they really understand is talking about risk. How much does it cost? And the thing here is we need to talk about how much does it cost if you don't do anything. Yeah,
so the cost of inaction. Exactly. And I like the way you put it, the risk of doing nothing, which is a significant risk. That's great. Well, I do have one more question for each of you, but just before we jump to that question, we're going to move into a Q&A after this. So for all the participants, if you have questions, please put them in the Q&A box, and I'll be tracking that. So just encourage folks to put in any questions you have. And while you think of your questions, final question for the discussants. We are heading into a whole bunch of, absolutely global events, but then probably also lots happening at local and national levels as well. But just from a global perspective, we're looking at the Food Systems Summit. We're looking at the Climate COP. We're looking at conventional biological diversity. The CFS certainly has all sorts of activities planned, and the list goes on and on and on. So within this context, it's going to be really important that, all food system actors, and we are all food system actors, put forward really strong calls to action. So like I did with the panelists, I would like to pose a question to each of you. What is your call to action to the CFS community, and especially your call to action for governments? So Francesco, let me start with you.
Thank you. And I'd like again to show you something.
Please.
I really agree with what Alvin said. We should manage the complexity of the food system. But I think we're getting better at understanding what are the different dimensions. I mean, there's been this year very interesting reports published by the UN Organization, the State of Food Security and Nutrition, the Global Panel of Experts on Agriculture and Nutrition, and they all take this food system approach. So let me share this image, and this is what I would like to see happening in the next few years in the food system, with a vision of having a food system that delivers on healthy diets, safe food in a sustainable fashion. In fact, becoming a solution to the climate challenges. And how do you do that? there must be changes in policies that shape the supply and demand for food. And there are, in reality, many good experiences. And we heard in the previous part of this event, a lot of interesting and successful policies, but they have to be considered together. And just let me highlight in this 2 columns I have on the side of the bubble, good food procurements, healthy diet delivered through schools, through public institutions, hospitals, canteens, good food control systems that prevent from foodborne disease events to occur, sustainable food production, but governments that take under their control the offer of food, for example, through regulating or intervening on pricing, through, for example, fiscal policies and regulation, subsidies, and managing the scandal of food waste and loss. And just highlighted a few, but you can see there are a number. Now, what's my single question, single ask to the Committee of Food Security? Committee of Food Security is currently discussing voluntary guidelines for food system and nutrition. And my ask is that they do prioritize health impact. And health impact, as we've seen, is major, but it's actually a major contribution to the development. So there's no contradiction. If we prioritize health of the people, of the workers, and we take a One Health approach by also considering the health of the animals, we're having a plus in any way. So profit shouldn't be seen as a contradiction there. So my ask is that they recommend a comprehensive set of actions that have the potential of making systemic changes in food system without neglecting anything for ideological motivation. Thanks.
Thank you, Francesco. Owen, the same question for you, please. What is your one call to action, especially to governments, and especially in light of some of the opportunities we have in the year ahead?
Yeah, so I think, let me start. One call to action is difficult. There's so much to do, but anyway, let me start by, I think, one important a thing happened this year, which was the HLPE report on the narrative towards 2030. In there, they actually described that the food security and nutrition concept evolved. It is, food has not only to be accessible, affordable, stable, and utilizable, but it also, there is the notion of agency, meaning you have the individuals and the groups have to be able to be their own food agents, and the notion, the concept of sustainability. And I think what you really need to do as a CFS community is to act upon this. So we need in the current undergoing a work stream, so the guidelines on food systems and nutrition, on the agroecology work, we need to integrate that evolved concept of food security. We also need to do that going further. So with all other work streams that come from the CFS. And I think we need to listen to each other and then act together. I think that's what I hear. I participate myself in those processes. We talk a lot, but I don't think we always listen carefully to the other one. I think we need to start doing that, and then very easily we need to get these voluntary guidelines on food systems and nutrition done, and these guidelines need to be actionable, and they need to include what I just said before, this new concept of food security, meaning the sustainability is an important aspect of that. Agency is an important aspect. So we need to make those voluntary guidelines actionable for all different actors. A long call.
Great. Yeah. You've both provided very comprehensive lists, so thank you. We have a lot of work to do together. So thank you for those thoughts. I want to bring the first panel back into the discussion here. And for those on the first panel, I had posed a question to Francesco and Awan about narratives. And I want to come back to this because I think narratives are so important. And I'm wondering, from your perspective on the ground, what challenges has your initiative faced in countering kind of the prevailing narratives on food systems, and how have you overcome those? So, you know, we have these stories about what's possible and what's not possible. And so the question is really sort of what sort of stories have you had to fight against, and how have you fought against those stories and tried to change the story? So I don't know if somebody wants to jump in or if I should just point to somebody, but I'm looking at the faces on the screen. Nilani, what about you? Do you have any thoughts on that?
Yeah, sure. I wouldn't say that we have challenges in quite the same way. You know, increasing fruit and vegetable sales drives footfall into store. So in terms of the initiative itself and its ambitions, you know, that's not difficult to sell to the business. What is harder to sell is how we actually do it. And, you know, we try a number of initiatives. Not all of them deliver the same outcome. So that's the bit I think that is the real challenge. And actually, how do we get customers to increase their consumption of vegetables in particular? So some of the things that we have learned along the way have been, how do we increase customers' diversity of vegetables? They tend to have a very narrow repertoire of foods that are familiar to them that they consume. Prices, I'm not sure that price is always the barrier. And you know, when we've seen that particularly low-income groups have been given a voucher towards their fruit and vegetable sales, which is something that the government gives as a benefit, our data actually shows that those customers don't necessarily buy differently. They don't buy more. And I think that's where we need to kind of look at how can we tackle this issue to get customers to increase their repertoire of vegetables. And we're using things like incentives to try and do that more. But ultimately, it's about looking at how can we nudge customers in their buying behaviours, because at least during lockdown, we've seen a real move. Initially, people did scratch cook, some customers, but the majority, and certainly by June, 3 months into lockdown, people were fed up of eating their own food, and we saw a real shift into assisted eating and meal assembly, so putting things together and sticking it in the oven. They had the time, but they were, you know, they were bored. So I think there's a much bigger question around the roles that we can all play in helping customers to eat better. And the challenges that I get are much more around, you know, what's the most effective way to do that?
Great, thank you. And I think this is connected to one of the questions that has just come in through the Q&A box that maybe I'll pose to Lorena, which is essentially, we know what we need to do. And given that we know what we need to do, why are more governments not moving ahead on the aspects which they know will move us along the right trajectory to healthy, safe, and nutritious diets which protect nature? What is stopping governments from acting? Lorena?
Bueno, la pregunta es pertinente y compleja. Efectivamente, la narrativa o el discurso de educar a las personas para que cambien su conducta es un discurso que parece cómodo, que parece fácil, pero cuando las políticas públicas tienen que ayudar a las personas a cambiar de conducta, el discurso se hace más complejo, porque ponemos encima de la mesa las medidas fiscales, los impuestos, los subsidios, las prohibiciones al marketing, a la publicidad, el etiquetado frontal de advertencia, que son políticas más bien restrictivas, son políticas menos amigables y son políticas que algunos sectores rechazan o se resisten. Los sectores del área más económico no visualizan el costo de la no acción, el costo de la inacción. Creo que lo dijo, es muy importante poner también la información respecto al costo de no actuar, el costo de la obesidad, el ausentismo laboral, la falta de eficiencia, los costos sanitarios, etc. Un conjunto de costos que conlleva el no actuar. En el caso de Chile, tuvimos que poner encima de la mesa esta evaluación de costos para que los sectores económicos y comerciales visualizaran que era necesario avanzar en medidas regulatorias y legislativas para modificar los entornos alimentarios y para facilitar el cambio de conducta de las personas. Las personas saben, muchas, la mayoría sabe que es más saludable comer frutas y verduras que alimentos ultraprocesados. Sin embargo, esos alimentos ultraprocesados son de menor costo, están muy accesibles y disponibles, y la gente tiende a recurrir a esos alimentos. Además, el marketing es muy llamativo, muy atractivo, especialmente para los niños. Por lo tanto, las dificultades tienen que ver a la hora de poner restricciones y prohibiciones. Ahí es cuando empieza un relato que se desencuentra. Mientras hablamos de educar a la gente, estamos todos tranquilos y actuando. Pero cuando vienen medidas más estrictas, más restrictivas, impuestos o subsidios, entonces la discusión se hace más compleja. Esa es la experiencia que puedo transmitirle. Es posible actuar en todo caso. Hay que trabajar en los fundamentos y en los argumentos y en la evidencia científica para convencer a aquellos sectores que no están tan convencidos.
Great. Thank you, Lorena. Very, very interesting perspective. And we're talking a lot about governments, and that's certainly been a lot of your experience, and really appreciate your expertise in that sector. We've got another question about, well, what about the private sector? We're talking a lot about governments and interesting calls for action by governments, but what about the role and responsibility of the private sector? And Alvin, maybe I'll pose this question to you, just given your vantage point and your past experience.
Yeah, thank you very much. I think indeed the private sector has also a responsibility to act in this transformation on food systems. It would be illusional to think that governments can do it alone. I think that's important, that we need the private sector, as we also need the NGOs. And what we see in our experience when we, for example, in the area of nutritional policy, reduction of salt or sugar, things like that, when we discuss with the private sector, so we try to agree with them on kind of an action plan, how should we reduce salt or sugar. I think what we see is the first steps are always the easier ones. So that's easy to say, okay, we reduce a little bit. And then when you get to a point where it starts to hurt, it's really difficult to move forward together. And but I also, what I observe is the private sector is, or some actors of the private sector, they certainly thinking also they are engaged and involved. And I think we would really need here, if you want to have a call for action on the private sector, is really we need to kind of try to define objectives together. And then they need to be aware that maybe governments, with a pull and push strategy, follow up behind. So that you try to set out the path together. They have to go their way, but we know what direction that they're going to have to take. And we kind of need to help them get there with what I would call pull and push strategy. So the right incentives, maybe also the right punishments, so fiscal measures. But indeed, that's then also getting very complicated when you start to introduce these kinds of pull and push measures from the government side. But I think, as I said before, I think the dialogue and participating in a meaningful dialogue, I think that's the first step to that the private sector certainly should be taking, and basically is taking in what I observe.
Great. So you talked about objectives, which I think is an interesting thread. And we can have very specific objectives, but from my perspective, objectives are based on sort of the values that we're bringing to what it is we're trying to achieve. So I have a question for Solomon. Solomon, you've talked about this in describing your work, but I just want to bring it up a little bit more clearly. What are sort of the values that underpin the work that you do in Rwanda? And I ask this in part because, first of all, I've heard folks say that it is our values, it's our deep principles that will be really important social technologies to help us navigate times of disturbance and disruption. So I think understanding those deep values and principles, very important in that context. It's also important, I think, around things like the Food Systems Summit. As we have global conversations about what matters to us, I think what needs to surface in part are what are the values that we're bringing to our future of food. So Solomon, I'm just wondering if you could point to a few of the values that underpin your work in Rwanda.
Absolutely. Thank you so much, Ruth. Yeah, so I totally, you've definitely put it well that values are, we also are a very values-driven organization, and values manifest in our work and our everyday culture. I mean, we are talking about food, and we all appreciate and know the importance of how food not only just nourishes populations, but also it has other amazing benefits of bringing people together, of connecting people from all walks of life. So the values aspect that connects we as a big human family to what we're doing is very important. So a few values, just to run through them. The first one really is that we live and operate with and within the community. So for instance, we are headquartered on a farm, and which serves as a living laboratory for continuous experiments and improvement. We all, as someone mentioned, malnutrition is a complex, multifaceted issue, and there's no one size fits all solution to it. So we try new crops and agricultural techniques to adapt, learn and relearn. The second value is that we are fully committed as an organization to meeting the smallholder farmers where they are and their needs. Our program model was co-created with partner families. It's tailored to address the challenges and bring the change they want to see. Farmers have a huge potential. They have expertise more than we do. All they need is an opportunity to information and also access to inputs and other things that are part of the food value system to support them. The other value is, as an organization, we believe in changing systems and not just treating symptoms. And for us, what this means really is to move from an emphasis on the quantity of production to a greater focus on the quality of what is produced, so that we are building the capacity and positioning smallholder families to be able to grow and consume diverse diets for their own families, and also be able to contribute to the larger markets. Lastly, we take partnerships as or collaboration as an important value. We acknowledge that we can't solve malnutrition alone, but we can solve it together.
Fantastic. Two threads I want to pick up there. I have two last questions. The first one is for Dr. Dow, and I would like to ask you from the Q&A box, essentially, how do we ensure that sort of local food systems and related territorial approaches are explicitly addressed in the Food Systems Summit. Do you have any ideas briefly on how we ensure sort of these local systems and territorial approaches get on the global agenda?
I think that we need to the policy action. In Vietnam, we besides promoting the agricultural exportation, we also have another direction to support the local product, and we call this this is one commune, one village, because and we integrate this into a new rural development program. I think that we need the policy program for this, and promoting the local production and local food system is a very important approach. And in Vietnam, we think that agriculture nutrition sensitive is also approach for the difficulty area, remote area, etc. In this area, we maybe we don't need to develop the commercialized agriculture, but the agriculture nutrition sensitive approach is also important. And in Vietnam, we integrate this in the Zero Hunger Initiative. I think that FAO and UN also raising the question as the promotion of the Zero Hunger Initiative. And I think that this is very interesting. Vietnam is the first country amongst Asia, Southeast Asian country to realize Zero Hunger Initiative. So I think that need some policy for this. Thank you.
Thank you. And you also have touched on the need for collaboration. Solomon brought it up. I think almost everybody has brought it up. People have talked about walking together, working together. So Francesco, I'm going to pose the last question to you, which is essentially that we've talked about the synergies and sort of the multiple benefits of healthy food systems. But what tensions and trade-offs do you see, and how can we really lean on an integrated, holistic approach to help tackle them? What is required of us as a global community at this point to have a more integrated and collaborative approach?
You raise a very important point, and definitely the wording it could be around trade-offs. But we have to perhaps establish some red lines that we shouldn't go beyond. And the trade-offs might be, at least in this space, might be around health, sustainability, and economics. But there is a red line below which we cannot go for health. So, and I understand that there could be also a red line below which we cannot understand if we want to live on this planet as a species, you know, you know, in the next centuries. So where is the point that we should compromise? I think that's important questions. We also are trying to see more the positive side of it, of the trade-off. So it's not giving up, but it's actually showing the synergies. And that's perhaps where we need to work more closely. I mean, definitely we have shown a synergy between choosing healthy diets and improving the environment. There's almost a perfect alignment, not a perfect alignment, but a very close alignment. You know, perhaps, you know, there's some issues around certain cultures and the use of water. So we can't grow all fruit and vegetables everywhere. I mean, there are some areas that are perhaps more appropriate. But that's clearly a win-win. Where perhaps we may have to see a different turn is the profitability part. So there must be an effort from government to make investments and to guide private investments towards the more, let's say, health and environment protective choices of industry in the food sector. I mean, we have in the past privileged through a lot of investment funds the production of cereals. That is perhaps something that needs to be changed. But that requires, an alignment of research investment, of infrastructure development to actually shift towards, better production of fruit and vegetables. We're about to enter this year of fruit and vegetable. We're still in the decade of actual nutrition, but we're going to focus on fruit and vegetables. And you can see the delay in the research on productivity of fruit and vegetable, for example. The other one is animal source foods. I mean, there's been an overgrowth of some of these industries in certain parts of the world at the detriment of health and the environment. So how can we actually now think of reconversion? That's where the public sector should help, perhaps the private sector going into a virtual spiral rather than, in the situation we have now. So we need innovation, we need new technologies, we need vision, and we also need from the point of view of the investors, a different way to think of risk. Perhaps there is a risk in making big shift and big reconversions, but actually that could be an extremely interesting and extremely productive shift that we can make.
Wow, fantastic. Francesco, you talked about synergies, you talked about innovation, you talked about vision, and I think that all of that has been represented today in our discussants and in our panelists. These are really inspiring stories. These are folks with deep experience and expertise, and I'm really, really pleased that you were all able to join us today. You can read more about these initiatives in Rwanda and Chile and the UK, as well as 10 other great examples in a set of new reports that the Global Alliance has just published called Systemic Approaches to Healthy Food Systems, Approaches to Policy and Practice, as well as a government guide to action. And I think the links are probably in the chat box. As well, Owen mentioned that you will be able to read about the case study in Vietnam alongside other examples in a report that is coming out later this year, as well as other work coming out of the Sustainable Food Systems Program on towards a common understanding of sustainable food systems. So lots of inspiring examples, and I know it's something that we are certainly trying to hold up and that others are as well. So encourage you to look at those publications and become inspired and make connections between these amazing initiatives. You've heard calls to action from our panelists. I'm not going to do a comprehensive overview, but for instance, we've heard about the need for walking together towards a fair and more equitable food system. We've heard about powerful fiscal policies. Solomon talked about elevating investment in local community-based production systems. We talked about clarity and consistency of standards. True cost accounting came up several times, and changing business models through true cost accounting. We've heard about the promotion of agroecology and needing stronger evidence for agroecology. Francesco in his slide had a very comprehensive list of various approaches that we need to take. And Owen talked about an interesting piece around sort of integrating an evolved concept of food security, and the list goes on. So I hope that everybody has found this engaging and enlightening. I certainly hope that this has been a contribution to the global dialogue that is so needed right now in terms of the centrality of food systems in the face of many of these major crises and challenges that we're facing. And I certainly would like to, as a final comment, just wish the Committee on World Food Security best of luck with the rest of their proceedings this week. And I'm sure we'll see some of you on World Food Day with all the various things that will be happening between now and then. So again, a huge thank you to our discussants and our panelists. Thank you for joining us. Thank you certainly to the teams behind this that have helped make it happen. And I wish you all well with the rest of your day. So thank you. Until next time.
And thank you.
Thank you. Bye.
Thank you. Bye.
Okay.